Never mind.
We've got another topic that's winter and weather related.
Well, it is. It's about seasonal affective disorder. And to tell us more about it, we're joined by Dr. Junaid Azam, who's the GP and clinical lead for the Bradford District and Craven Healthcare Partnership. Dr. Azam, welcome to the show.
Thank you for inviting me.
No, it's a pleasure. Now, for people who don't know, what is seasonal affective disorder?
Yeah, it's a good question. I suppose the way of describing it is that we know that when there's a drop in sunlight and temperature, there's impacts that not only on your physical health, but it also has an impact on mental well-being as well.
Very true.
Some people feel a bit more withdrawn, low, or fatigued this time of year. So it's all those kind of things.
And is this, like the lack of vitamin D, and is this, is it like, because so many people get it done, I can be one of them. Is this where people sometimes get them UV lights in the house, to try and keep, you've seen that before, when they get this seasonal, like not a depression as such, but they get, a bit fed up. And I've seen on a programme that some people get it's like a UV light and it's meant to, help with that. Is that the same thing?
Sort of, yeah. I mean, I suppose the drop in sunlight's linked with lots of things, and yes, you mentioned correctly there, vitamin D is also one of the other things that suffers as well. But I suppose the whole point of this particular campaign was to focus on people's mental well-being, and yeah, you're right. I suppose these lights are ways that people try to naturally combat that. But I suppose there's no way of getting away from the fact that the days are getting shorter once you head outside. So that's
it's
the kind of
true. I mean, I do think that, when things dip in temperature, the weather gets, not as brilliant and it's dark a bit earlier, maybe people stop socialising as much in the evenings after work and, no one wants to do as much maybe, so you don't see as many people, would you say? Do you think that's something to do with it as well, than, winter months?
Yeah, definitely. I think people sort of take the easy option in terms of just sort of staying indoors, having entertainment at home, and I suppose it kind of can lead to a bit more isolation, and these things all sort of add up together, and that's why people feel a bit more low this time of year.
And it's very common. Very common.
Yeah, I was saying, is it also Christmas? Does Christmas stress people out? I mean, there's a lot of pressure on Christmas, a massive build-up to it. There's pressure on shopping. Everybody is short of money, apart from the billionaires. Everybody is short of money. Christmas is expensive, and then there's such pressure, isn't there, on families to get back together, and it's going to be a special day.
There's a lot of pressure on the day.
There's a lot of pressure on the day. That can be a bit negative. Some people find Christmas really hard.
Yeah, definitely. We're definitely seeing that increasing year on year, and obviously the stuff that people see on social media, the John Lewis adverts and all these things, they all paint a sort of rosy, happy picture, don't they? And not everyone's there, and I suppose that can feed into the guilt a bit as well and exacerbate the way people are feeling. So yeah, all these things is what you do contribute to the way people are feeling.
Yeah, but you've got a bit of a campaign going, haven't you, so that people are not alone.
That's right.
A few clicks away from help. Tell us about it.
Yeah, so hopefully we're going to focus on the positives here in terms of what people can do. So I suppose the first thing with the campaign, like you just said, it's, a lot of people feel this way, so you're not alone, and that's the title of the campaign. You're not alone this winter, and one of the things we want to encourage people to do is to sort of help and sort of look for those supports locally. So there's an app that we've got. If everyone Googles Healthy Minds, and you'll get the local website that comes up, and on there you can search for over 300 local services. So there's everything from things like walking groups to counselling, and you click a filter and it goes according to your specific needs and where your location is as well. And there's a lot of things on there, whether it's face-to-face groups, telephone groups, and they've got practical mental health tips and advice as well. So that's one way people can access support and hopefully improve things in their day-to-day life.
So rather than doom scrolling, if we search for Healthy Minds, that will signpost us to groups and good advice, sensible tips, things we can do, counselling if we need about talking therapies, etc., etc.
Yeah, that's That's right, and hopefully it'll empower people with some aids and things that they can do practically to get through the winter. And for those people that struggle to connect digitally, there is also a guideline service that we've got as well on 0800 884 884, and that's available every day, 8 a.m. to 12 a.m. if people are a bit more reluctant to use tech. So that's another way of seeking support.
It's such a good thing, this, because obviously, when people think of winter and this time of year, they think, the weather's dropped, the temperature's gone, Christmas is coming up, but as well, January's a really low month. It really, I think January is a really tough month. So it's not just because you do have the build up to Christmas where there's quite a bit of social events, no matter what weather. But I think January, if I had to pick a month where I was going to get struck down by feeling a bit low due to,
there's a reason
it'd be January.
Unless you're a divorce lawyer, they love January, but everybody else, everybody else is a bit of a seasonal dip in January.
No, it makes sense. It definitely does, and it's really good that there's this support available to people, because I do think a lot of people just think, do you know what, just shut up and get on with it.
And I don't think we should do that. I think the British stiff upper lip is not helping us. I think we shouldn't be afraid to talk about it. It's just because you're right. Your friends will be feeling it too. If you need to go and get help, that number was 0800 1884 884. Yes, look at me. 0800 1884 884. That's the guideline number. There's lots of support out there.
There is. Is it for a specific age group? Because
some things will be age specific. Are there special things for teenagers?
Yeah, so we do have a specific group. If you go onto the Healthy Minds website, we've got a section for young people, which I believe is, I think it's 12 to 18. I might be wrong, but if you look on the website, you can select a filter at the top, and you can sort of filter it down by category. So if you're looking at the younger end, or even the other end of the spectrum as well, 65 plus, then it should give you stuff that's age appropriate.
Something for everyone.
Because obviously, exactly, there's no one size fits all. So we'd encourage people to look for the right service that meets their needs.
Well, my top tip, if you're feeling a bit gloomy about the weather, is to focus on the fact that we need the rain to fill up the reservoirs. So find the positives. That's a Mary Poppins thing, isn't it? Is find the little positives in all of the things. And so I'm going to. I think I like to do to cheer me up is to play a tune on the radio. Preferably one that Danielle doesn't
like. I can't recommend your playlist to anyone for a feel-good.
It's a personal thing. So I'm going to play a tune on the radio. That one would cheer me up. I'm going to focus on the rain filling the reservoirs up. I'm going to remember the number 0800 1884 884, just in case I need to get some advice. And I'm going to remember the Healthy Minds website. I'm going to thank Dr. Azam for coming on the show. Thank you, Dr. Azam.
Thank you.
You're welcome. You're my pleasure. Thank you.
And I'm going to play Garbage